Venepuncture is the process of inserting a needle into a vein for the purpose of obtaining a blood sample. It is the most common invasive procedure taken within the UK today. As healthcare professionals, it is easy to become blasé and forget that for a patient, having a blood test may be a significant event, not only because of the process, but because of what the results may reveal and the implications for that person's future health. It is important, therefore, that anyone who undertakes venepuncture not only has the technical skills required, but is also able to appreciate the concerns that a patient may have and be able to put them at their ease. As venepuncture is an invasive procedure, consent must be obtained. This can be implied by the person arriving to have the test done, verbal consent by agreeing to have the test, or where there are mental capacity issues, written consent needs to be obtained.
Mrs. Brown, would you like to come in, please? If you'd like to take a seat.
Thank you.
Do you have a form for me, Mrs.
I do.
Brown?
There you are.
Thank you very much. Can you just confirm your name, date of birth and your address?
It's Sadie Brown, 14th of September 1959. It's 14 Brigstock Drive, Chesterfield.
Lovely, that's absolutely fine. And do you know why you're here today?
Yeah, Dr. Carter's a bit concerned about my kidneys. He's asked me to come and have a blood test.
Okay. Would you like to take your jacket off for me, please?
Put it over there, is that all right?
That's absolutely fine. You haven't had any surgery in either of your arms, have you, at all?
No.
No, not that you know of. Okay, then.
Okay, that's fine, yeah. It's a lovely day, isn't it?
It is a lovely day. Have you got something planned?
Unfortunately, I'm at work in another hour, so...
The tourniquet is applied approximately 10 centimetres above the proposed insertion site. It needs to be tight enough to restrict venous return whilst continuing to allow arterial inflow of blood. This can be achieved by placing 2 fingers underneath the tourniquet whilst it is being tightened. DCHS uses the Vacutainer system. This consists of a plastic holder and a needle. The needle can be green for use in well-filled veins or black, which is finer for thin or fragile veins. These needles have a safety guard which is flipped over the needle once it has been removed from the vein. An alternative is the butterfly, which is used for high-risk patients or those with difficult-to-access veins. The butterfly is equipped with an automatically retracted needle, preventing any risk of needle stick injury. Ensure that you check the expiry date on disposable products before use. The best place to obtain blood is from the antecubital fossa. Here the veins are large and fairly superficial. Once the tourniquet is in position, look at the veins and gently palpate the area to find a vein which is bouncy under your fingertips and is smooth to touch.
Okay, Mrs. Brown, I'm just going to loosen the tourniquet. Are you allergic to anything that you know of? Because I'm going to clean your skin.
I'm all right.
The tourniquet should not be left tightened for more than 1 minute, as this can cause hemolysis of the blood. Veins that feel hard, knobbly, or ones which lack bounce are likely to be difficult to obtain blood from. Areas which are bruised, red, or edematous should be avoided. Where a person has had damage to an arm or the associated lymph nodes, such as stroke or surgery, again, this arm should be avoided. Check whether the person is taking any medications which may influence the clotting process, such as aspirin or warfarin. Blood needs to be taken in the correct order of draw to avoid the risk of the reagents in the bottles contaminating later samples. cards detailing the correct order of draw will be available for you to take away during your practical session.
Now you're going to feel a sharp scratch, okay? So if you'd just like to stay nice and still for me.
Once the first sample has started to flow into the sample bottle, the tourniquet can be loosened. After all samples have been obtained, the final bottle should be removed from the holder before the needle is withdrawn to reduce the likelihood of bruising.
You don't feel faint or anything? You feel all right?
No, I'm fine, thank you.
That's lovely.
As you have seen, Venepuncture requires a mixture of technical and social skills to enable the process to be undertaken with the minimum of discomfort and distress to the patient. You will now have the opportunity to gain some practical experience, initially on mannequins, followed by a supervised period of practice on patients. It is important for you that when you start taking blood, you identify those patients who have reasonably well-filled veins and who offer you the best chance of success. Once you have successfully obtained blood on a few occasions, you may feel confident enough to take blood from patients with more challenging veins. Bear in mind that no matter how skilled we become, any of us can have a bad day and not be able to obtain blood. Within Derbyshire Community Health Service Venepuncture policy, we recommend you have 3 attempts only. Following this, colleagues may be able to support you by taking the required samples. Remember, be confident, be honest, take time to find the best vein. Listen to your patient. They know their veins, and if it is not your day, acknowledge this and let a colleague obtain the sample.
Okay, Mrs. Brown, that's it for today.
Right, so when do I get the results then?
Right, if you want to either make an appointment to see Dr. Carter in a week's time, or you could ring the surgery, then the results should be back there.
Oh, that's lovely. All right,
Okay.
thank you very much.
No problem, have a nice
Bye-bye.
day. Bye.